Good day. Today I am presenting a practical solution to one of healthcare's most persistent challenges, making effective chronic care accessible and affordable. The Community Acupuncture and Wellness Hub that we're going to discuss here applies traditional Chinese medicine within frameworks outlined in Niles' Basics of the U.S. Healthcare System, demonstrating how alternative delivery models can address the iron triangle. The US healthcare system, as many know, operates within what Niles calls this iron triangle, this balance between cost, quality, access. Uh, Chronic pain, by some estimates, affects 50 million Americans, with treatment costs exceeding 635 billion annually. For low to moderate income populations, conventional pain management creates an impossible choice, spending limited resources on expensive care, accepting poor quality alternatives, or foregoing treatment entirely. This misalignment of the iron triangle drives our initiative. Niles emphasizes that sustainable healthcare requires balancing all 3 points simultaneously, something current chronic pain treatment fails to achieve. There are certain vulnerable populations we need to identify facing structural barriers. Our target population, for instance, are working adults earning 30 to 60,000 annually. And this is what Niles, the author, terms healthcare marginalization. They earn too much for Medicaid but face catastrophic health expenses. Traditional acupuncture is in a private clinic between 150 to up to sometimes $300 is completely inaccessible. And so this population is really exactly whom the author discusses regarding healthcare disparities. They work full time, they contribute to the economy, yet they cannot access preventive care that would improve both their health and their productivity. So our model integrates six core concepts. Um, we've discussed some in the past. So basically, we're shifting from a reactive public health intervention to more of a proactive population health management. So we're moving upstream to prevent complications rather than treating crises. Next, we position this community acupuncture wellness hub within the outpatient continuum as a preventive alternative to emergency care. We also are employing a stakeholder governance through community boards. We ensure that would ensure patient governance, patient voices in the operations. And we also utilize sliding scale financing to address the cost barrier directly. We're also establishing quality indicators which align with value based care principles. Uh, Lastly, we're embedding health literacy to power patient engagement. And these are not isolated concepts, they form the integrated framework that the author argues is essential for 21st century healthcare delivery. Community acupuncture reimagines service delivery within what is described as the outpatient care continuum by treating multiple patients an hour calmly in a shared space. We achieve operational efficiency while we preserve clinical quality. Patients are receiving care side by side in zero gravity chairs. And this really creates a communal healing environment that many report as therapeutic itself. So, this model reduces per visit costs by up to 75% through economies of scale, which aligns with the discussion in the book as well. Um, so, the patient flow is streamlined. There's a brief intake treatment in the group space. There's optional access to community resources. And then there's a scheduled follow up. So, this efficiency allows us to serve between 20 to 30 patients daily versus about 6 to 8 patients if you're seeing someone in a private situation, in a private clinic. So, in order to achieve this, we need to look at money and how do we finance this. So, we're going to really need to diversify our financing mechanisms. There's no single payer source that can support this type of mission driven care. So, our model employs a four-tier approach, as we see here. 50% of the revenue may come from sliding scale patient payments, about $20 to $60 per visit. um, there is another 25% that might come from insurance billing, but that's questionable. 15% would probably come from grants and community donations, fundraising tied to our mission, and 10% from any in kind partnerships with local organizations providing space, marketing, referrals. So it's really a mixed model, and this creative financing, which is discussed in the book as well, doesn't depend on a fee for service limitation as much of modern medicine is dependent on. Moving forward, we are looking at our hub operating under a stakeholder governance model with three interconnected bodies. There's a community advisory board, there's a clinical quality committee of licensed acupuncturists, ensuring evidence based protocols and maintaining clinical standards. There's a partnership council, which connects us to FQHCs, primary care clinics, and behavioral health providers. And so this structure really embeds a community voice while maintaining clinical standards, which is really important to further this type of growth. Um, so, as we were discussed in the Niles book as well, quality indicators have to reflect the iron triangle balance. So we can't just measure just one dimension. So we have to look at access wait times. We have to look at cost metrics. We have to look at quality indicators, which are basically patient satisfaction. And so we really put these together, these KPIs, as what are considered essentially what matters for better health outcomes, right? So lower costs, improved access, and furthermore, as we get through chapter 14 in Niles' book, there is a discussion that healthcare quality depends on both rigorous safety protocols and health literacy. You can't just have one without the other. So our risk mitigation includes employing only state licensed acupuncturists. For instance, California it requires extensive training. National board certification is optional. We follow clean needles technique standards. We maintain comprehensive malpractice coverage and conduct quarterly outcome audits. Equally critical is the health literacy. We provide multilingual pre-treatment education, set clear expectations about treatment duration and outcomes, that acupuncture works cumulatively, not as a one-time fix. And we offer accessible digital resources, including videos, FAQs in multiple languages, and we train all staff in cultural humility. So there's this dual approach that will call for both clinical safety and patient empowerment, so patients can understand their treatment becoming partners in their healing, instead of just passively receiving treatment. Lastly, our vision aligns with what has been emphasized as population health and scalable delivery models. Year one establishes proof of concept. Year two, we're looking at expanding to three locations, excuse me. And by year five, we've developed a replicable toolkit that enables community organizations nationwide to launch similar hubs. This is not really about building a business empire or about creating a movement. It's really just about reducing ER visits by 40% in our patient populations, improving workforce productivity through reduced sick days, and modeling adoption in 10 different cities nationwide. This represents the fundamental from treating individuals to transforming population health outcomes.